My name is Dr. Molly Maloof, and I'm a physician working in San Francisco. And what do I love most about private medicine? Well, hands down, it's the amount of time that I get to spend with a patient. I really feel like private medicine offers the ability to sort of restore the doctor-patient relationship from the past, but also move it into the future using lots of new technology. And that's essentially why I do it. And I've had great results, and I just really adore spending time with my patients. They're wonderful.
I'm Bill Goldberg. I've been practicing private medicine for 11 years now. And what I love about it is I get to spend time with my patients. I'm not rushed, and we get to know and trust each other more and more as the time goes on.
I'm Sharon Batista. I'm a psychiatrist in private practice in New York City. And the thing I love most about private medicine is having a real personal relationship with my patients that goes well beyond the traditional relationship that the insurance industry and organized medicine kind of wants us to have. I love that I am accessible to my patients, that I can be responsive to my patients, and that my patients also value that and come to see me for particularly that reason. I think private medicine is personalized medicine.
I'm Jonathan Schmidt, and I work at Priority Physicians in Indianapolis, Indiana. And the thing I love most about private medicine is having the freedom to spend time with patients and get to know them and really affect them on a personal level.
What I love most about private medicine is being able to do what I think is right for my patients without having insurance companies or really anybody else interfere and telling me how to take care of my patients.
My name is Chris Nussbaum. I'm a physician in Tampa Bay, Florida, and I own and operate Concierge Care Tampa Bay, a concierge membership-based practice there. The thing that I love the most about this version of medical practice, and I've done just about everything in internal medicine you can over 30 years, is the amount of time I get to spend with my patients. Whatever they need, I can provide because we're working together for the same common goal. There's no intermediary telling me how to practice medicine, and in fact, my patients come back constantly bringing their friends, saying that this is the experience they've always been looking for. It really has empowered me to enjoy the back half of my medical career. I already made a lot of money in medicine. I'm not in it for the cash. I really just get off on taking really good care of my patients and seeing the big smiles break out on them when they feel better.
Hello, I'm Dr. Jeffrey Melks. I've been in private practice for the last 10 years. I love medicine again. I just about retired from medicine 10 years ago due to the frustration I had trying to take care of patients in the limited amount of time that I had. And now I have the luxury of spending an hour if I need to with each patient and taking care of all of their problems, just like I was taught to do when I was in medical school. So I'm back to where I love the practice of medicine.
My name is Scott Livesay. I'm a gynecologist and I practice in Waco, Texas. Been there a long time, and my most important asset, I think, is the relationships I have with my patients. I really value those relationships, the closeness to the patients and their families, but I believe in personal communication. I don't believe so much in data entry while I'm interviewing my patients and during exams. I believe in personal communication, and I want to continue my practice in a little different type of model, more personal, possibly changing the way we see patients, but we're still going to do more primary care than we've been doing. 80% of OB-GYNs see their patients, 80% of those people in America are used for primary care, and so we're going to try to do more primary care for women. We may even do an occasional house call to save an emergency room visit. So we look forward to continuing in Waco to practice on a personal level, and we're looking forward to the future.
Hi, my name's Dr. Peggy Finston. I'm a psychiatrist, and 20 years ago I had a severe pain condition which led me to discover that there's really a very small box that is permitted in addressing medical illnesses and psychiatric disorders. And that's why I love private medicine, because I have the chance to combine acupuncture and other energy balancing treatments with medications and psychotherapy and discover with patients what might help them in a synergistic modality that combines Eastern and Western medicine.
Hi, I'm Kathy Weeks. I am a family physician practicing in Mooresville, North Carolina. And what I like most about direct care is spending more time with my patients and developing closer relationships and teaching. I love to teach and I love to talk about health and making your life healthier and happier.
My name is Robert Springer and I practice in Atlanta, Georgia. And what I love about private medicine is the freedom to maintain the relationships that I've always enjoyed with my patients. From the beginning, I've always been a relationship-intensive practitioner. I do my best work because I know so much about my patients, because I've had the luxury of spending time with them. And in the current environment with third-party payer reimbursement pressures on time to spend with patients, the private medicine practice and the models within that scope allow physicians to continue to have the kinds of relationships that we've always had and always enjoyed, and that always provide better care.
My name is Dr. Sinha. I practice in Old Town Alexandria, Virginia. And the thing that I love most about direct primary care medicine is it allows me to spend the time with my patients that they deserve.
I'm Dr. Patrick Roll. I'm building a direct primary care practice in Lancaster, Pennsylvania. And direct primary care for me is all about restoring the patient-doctor relationship.
Hey, I'm Talal Khan, and I'm here to answer the question, why do I love private medicine? For me, private medicine is about time and the ability to give time to my patients. We practice this concept of compleo salus, which is complete health. We start with prevention. A lot of my patients have had endpoints like diabetes, heart disease, heart attacks, and we work with you in solutions in preventing that in the first place. It's focused on lifestyle, it's a personalized coaching, using technology, and finding a way of life where you are well and appreciate wellness. And if you're unlucky and you get some chronic disease, then we find out ways on helping you deal with it and come up with robust solutions that keep you well.
Recently, I have rebranded my medical practice, and our new name is Innovative Healthcare and Laser Therapy. Innovative because we're going to start offering more innovation in our practice to meet the future needs of our patients. The world of technology is exploding, our knowledge is exploding, the human genome has been discovered to have great impact. These are innovative medical practices that we're planning to bring to our practice, but also share with you. And we're hoping that you will come along with us. Direct primary care is not going to be for everyone, but neither was laser therapy until people experience the healing of light that we've provided in our office for the last 10 years. So moving forward, we're going to have an exciting time. We're going to use that human genome. We're going to use the knowledge that has come about in how nutrients interact in our body, how our microbiome is affecting our body, how we're affecting our microbiome. And I think you're going to see a sea change of these changes evolving slowly in medicine. But we're taking the leap and we're moving fast, and we're going to be at the front of the pack.
Hi, I'm Dr. Steve from the Optimal Heart Attack and Stroke Prevention Center. And I love private medicine. There's a number of reasons why. But the one that always comes to the top has to do with quality of life. I can help patients reach their goals, their own personal motivated goals, to get to what they really want. And it's not their lab draws and it's not their urine samples. They want a better life. And so lifestyle comes out of that in a positive way to fulfill people. And so that's what private medicine has allowed us to do at the Optimal Heart Attack and Stroke Prevention Center.